Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take first year topic that is assisted exercises. So what do you mean by assisted exercises? Whenever the strength of the muscle is insufficient, or we can say the coordination of the muscle is insufficient for the movement, we require the assistance to compensate for the leg. It is called as assisted exercises. So, in another way, we can say when the force exerted on the body lever by the muscular action is insufficient for the production of movement or for the control of movement, an external force may be added to augment it. As the power of muscle increases, the assistance which we give that will reduced. Okay, so it is not necessary that the patient is having muscle strength or endurance. That means that he'll be able to perform the movement actively. Might be that is not sufficient for the compensation of the full movement, or to complete full movement. That strength or endurance is not sufficient. So in that case, we require the extra force to support or to complete that movement. So types of assisted exercises, it is mainly divided into two, that is manual and mechanical. Manual assisted exercises are again divided into active and passive. We'll see one by one in the detail. First, about the active assisted exercises. For the active assisted exercises, patient himself assist with the opposite extremity. Example, by using his or her opposite upper extremity or lower extremity. And it is much helpful for the home program exercises. So what are the advantages of active assisted exercises? So patient himself know the pain limit and availability of the range of motion. So the patient can perform these exercises within the pain limit range. Okay, so patient perform by his like own time, on his own time, and he can perform at home base, and he knows his pain limit range, so he can perform within the pain free range. Okay, or with the precautions he can perform in a proper manner. Then next is the passive assisted exercises. So it is called as the manual and mechanical. So manual assisted exercises means here the assistance which is given by the physiotherapist or by any medical professionals or by relatives or friends. Okay. So patient has to try to perform the movement up to his ability. We'll ask the patient to perform, or we'll ask the patient to assist us for the movement. Okay. So whereas in the case of mechanical assisted exercises, here the assistance which is given by the devices like the spring or pulleys or suspension therapy, etc. Okay. So, what are the principles of assisted exercises? First is the assistance. So, assistance which is given by the person should be changeable. Okay, in the beginning and the end of the range, the muscle strength is less. So, the assistance which is provided to the patient will be more. But in the middle range, the patient require less assistance. Okay, so whenever the therapist or any other relatives are giving the assistance, they have to keep this point in the mind that it should not be like passive movement, right? So the assistance should be given in such a way that even patient should help or patient should assist to complete that movement, and first let him to complete that range, or let him to initiate the movement. Once the therapist feel that now the patient is require assistance, then we have to give. And generally for the initial range and for the end range, we require the assistance force to complete the force, to complete the movement. Okay. Then next is the command. So this command is very important just to activate the patient, and of course it should be in a patient language, and we should not use our medical terminology. Okay. So it should be in a very the way in which the patient can get that of energy to assist us. Okay. And it should not be in a very, it should be in a polite way. Okay. It should not be in a very rough way, so that the patient will not assist you, because for this type of assisted exercises patient cooperation is must. So concentration, patient concentration is must during the this activity or during these exercises. Otherwise, this movement will be completely passive type, right? So patient should know when we are giving the assistance and how much he is able to perform the movement. So it is required for the effective performance. The speed should not be very fast. Okay, it should be in a patient's natural speed. Once the therapist feel that patient is learning this movement and patient is able to perform this movement in a proper way, the assistance force which is required is less, then gradually the therapist can increase the speed. Okay. uh, if it is more speed, then of course it is like passive in character, right? So repetitions, gradual progression of the repetition within the available range of motion should be given, and which helps to improve the range of muscle as well as to improve the muscle strength. Okay. So, what are the techniques? So, we'll start with the starting position, fixation, support, traction, antagonist muscle group, character of the movement, then repetitions, pattern of movement, and patient's cooperation. Okay, we'll see one by one the starting position and the pattern of movement. So, this must be well known, and it should be understood by the patient, and we have to show the starting position and the end position to the patient priorly, so that this movement will come in the patient's mind that he has to complete this movement. Okay. Then fixation, the adequate fixation of the bone origin of the prime mover is required to improve their efficiency. Okay. Then the third is the support. The part of the body moved is supported by the therapist throughout the motion. Of course, it helps to reduce the, or it helps uh, to complete the movement for the muscle which has a less strength. But of course, gradually, as we all know, the assistance or the support which we are giving, that we have to reduce. Okay. Antagonist group of muscle. So every effort must be made to reduce the tension on the antagonist group of muscle. Traction, we give the traction on the initial stage just to stimulate the stretch reflex. Okay. Then assistant force, the force used to augment the action of the muscle is applied in the direction of the movement. Okay, so this point we have to keep in the mind that assistant force should always be in the direction of the movement. If we give in the opposite direction, then it won't be a assisted exercises. Okay. The character of the movement, it should be a very smooth movement. Okay. And repetitions as like the number of times we repeat the particular movement, it should be decided priorly, and gradually we have to increase the repetitions. And of course that depends on the patient condition and the requirement of the particular muscle strength. Cooperation for this assisted type of exercises, patient cooperation is must. Otherwise, as we all know, it will be in the passive character, right? So to avoid this passive type of movement, patient cooperation, the understanding of the patient for this movement and patient concentration is must. Okay, so here you all can see this is the passive assisted exercises. Therapist is assisting for the uh, hip flexion movement, as well as in the this first figure the therapist is assisting for the knee movement. Okay, here the self-assisted exercises, patient is using his another extremity just to complete or to achieve the flexion range of the shoulder. Same way in the sitting position, the patient is performing. For the wrist also, we can perform this assisted exercises. After post-fracture patients, for the uh, hemiplegic patients, this type of exercises are very effective. Mechanical assistance, here the pulley is used by the patient to assist for the shoulder range of motion. Here the stick which is used by the patient to complete the motion. The suspension therapy which also helps for the improvement of the range of motion as well as to improve the strength of the muscle. Then what are the effect and uses? So patient confidence will get built up, particular joint range of motion will get increased, there will be increased in the blood circulation, then it also helps to reduce the muscle spasm, the tightened structures also will get stretched, then gradually the active movement will also be possible, and of course the coordination of the motion will get also improve. So this is all about a brief idea related to the assisted exercises. For the further detail, you all can refer the therapeutic exercises by Lakshmi Narayan as well as the principles of exercise therapy by Dina Kadi. Thank you.